Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. It's good to be here. And it's Wednesday night, getting late, so this is going to be a substitution for Tuesdays with Mark. Last time we talked about the interaction of shame and loneliness and suicide. So this is a continuation with the emphasis on loneliness, and I ran into a panel on the internet. They were discussing loneliness, the epidemic of loneliness, which is very interesting. So I'm going to take some few things from that panel, the Aspen Institute, and highlight them. One of the things that they said was that the UK is way ahead of the United States in addressing the problems of loneliness. For instance, they have a 24-hour hotline when people can call in and address their feelings. 24 hours, like, sometimes you can't wait for your problems to mull them over. You need to talk to somebody right away. So that's why, for my patients, for instance, they can call me at any time, and I'll give them a short, brief contact with them so that they can sustain themselves over the next time that we talk. The loneliest group from their statistics that they talked about was the age group between 18 and 22, Generation Z. So they were most lonely. They also felt that their health was worse than the other previous generations in terms of physical health, probably mental health too. And that's the age group we always quote as being most vulnerable. That group around 18, 19 to 24 have the high risk of suicides or suicide acts. So they're a very vulnerable population. 56% increase in suicides, the last report, over the previous year. It's really a difficult problem because these all are related: loneliness, suicide, mental health problems, huge in the United States, and seem to be growing, not diminishing. I mean, we have clinics that are packed with children waiting to be seen for depression, for suicidal ideation, for suicidal acts, and they can't get in them. And then once they're in them, they can't get out of them because they can get out of them, but there's no resources, treatment resources, not enough of them to meet the demand. Yet we're spending huge amounts of money, this is political, but on a war budget. And then we're cutting down on mental health services, particularly to the poor, particularly to black kids who are in elementary school. So that's not the only where we're discriminating, because in general, black people of color are often below whites in terms of receiving services. So that we mentioned in another talk of mine. So there's a lot of talks here, by the way. Check them out. So Carla Perisinota, Carla, she was a really great speaker, and she did a study on loneliness, and loneliness as a predictor of functional decline and also death. Her study was on 1,600 people over 6 years, a long study, 6 years, and she found that there was a 60% increase in functional decline related to loneliness, and also 45% risk of death related to loneliness. Those are large numbers. 1,600 people studied for 6 years. Now that's a study, following people, and then pulling together the results. She had a story of a 98-year-old woman who brought her to tears because the woman lost her husband, and then just her only activity was kind of moving back and forth between the wheelchair and the bed. I think that's what she said, and just so moving to her. And I'm going to talk about that later in relationship to a person I worked with, Mrs. G. But she was a researcher, very nicely moved. It's a lot of heartbreaking stories that you hear when you're doing research. But she had a lot of heart. This is Therapy for the Heart channel, so she had a lot of heart. Then there was, interesting enough that the reaction of the people to the presentation was, they didn't put it this way, but so what else is new? They joked back and forth about this because much of the research that was results that were presented weren't new. And I think it was the courageousness of the panel to address that, to pull that out and say, to make a joke about it and say, oh, so this is not new to you folks. Well, I can understand that because, a lot of it makes sense, common sense, but when you have research to back up the statistics, I think it makes it very, very dramatic and shows the reality of the large problem that we have versus just case examples. So it really pulls together the enormity of our problem. So they were nice to joke about it with each other. They said, well, when you get to the results sections of this talk, I hope something's going to be new. So, but I liked it very much. So there was a man there who was very interesting. I don't think this was new to people, maybe not. Dixon Shabanda. Excuse me. He was a researcher on the University of Zimbabwe. And he was an interesting fellow because, not a fellow, but I mean, he was a very likable guy. And also, he did some interesting research because he said the biomedical model they can't use in Africa because they don't make sense to people who they're trying to treat. For instance, the word depression, they don't relate to that, but they do relate to thinking too much. So that's their equivalent of depression, is thinking too much. I think that's fascinating. It reminds me of a study they did in Africa, and I reported on the 2 years ago maybe. But they wanted to get away. People weren't coming to the clinic to discuss depression. They were not attracting people so that they can help them. So what they did was they left out depression or problems, and they substituted stress. And when they substituted stress, everybody has stress, so they kind of identified with that, and they had a huge influx of people coming for help, just changing the word. Excuse me. Also, he had talked about grandmothers. Something that he calls the friendship bench. And anyway, he has some people. I think they contacted where the people that he has working for them, and they would call in, and the grandmothers would address the issues. And he said that the grandmothers, the way they could talk to people, they could convince them to get help because they were so familiar with the problems. Instead of saying that you needed treatment or therapy, helped people make the connection between those who could help them and through the grandmothers that worked with the Dixon Shabanda. So that's an interesting. I think that's very fascinating. The cultural differences that exist throughout the world, and how each culture, not each color, but different cultures and people of color maybe, versus how they're going to react to interventions that only people only in the West think about. You can't apply all of those to people. So this is a wonderful example of thinking too much equals depressed. Yeah, so they did a research. One of the earlier researchers at MIT did a research on mice. It was kind of interesting because he said that when mice, with their dopamine is a neuron transmitter, so when the mice were isolated from the group, and then once they were reconnected to the group, the other group of mice, their dopamine levels surged. So that was an interesting study. And I think you could equate that with human beings when they're reunited versus when they're separated. And look what's happening to our country now. The children are being separated, and what's happening to them? What post-traumatic stress syndrome are we going to create by this now? It was just announced today that Trump is not going to carry on that practice. But you know why? Why he's decided that? Because there was so much of an uproar from citizens and politicians on the left and on the right not liking that policy. So he had no choice. He had no choice. Yay, power to the people. And the way that there are so many links to people who were protesting and gathering and petitioning against this policy of separation of children. I mean, there was one instance where the nursing baby was ripped away from the mother. I mean, what kind of inhumane reactions are we going to have as a society? What are we going to become? We're becoming ridiculed by other nations because of the way we're handling our people. We're supposed to be handling them, but look at where we're cutting back, and as I said before, in the children, in piling up in clinics, in emergency rooms. They have needs. They're depressed. They're suicidal. Some of them. They can't find treatment facilities, and we are cutting back on essential mental health services. It's a crying shame. That's what it is. Another researcher, Julianne Holt-Lundstad, she did a meta-analysis. That means a combined analysis, combining many studies together and pulling them all together, 3.4 million people. And she looked at social isolation, being alone, and loneliness. And 3.4 million people. And she found that all of them predicted mortality. Every one of them predicted mortality. That's a big problem. Every one of them. So in other words, what they found is also, no matter how many Facebook friends you have, doesn't make a difference in terms of outcome of your being able to be less lonely, because it just didn't make a difference. It wasn't an impact on loneliness one way or the other. But what was most important, the variable was meaningful relationships with others. Meaningful relationships, not sporadic contact with people who often you don't know. Sometimes you do know them, but sometimes you don't know them at all. But you can, share photos and Instagram. That's not. Most of the time, that's not a meaningful relationship, but it means a lot to some people because, for instance, some people don't have contacts at all. So for some people, it's very meaningful. But in terms of combating loneliness and all these, the results of loneliness and functionality, decline in functionality and death, that's not going to do it. You need meaningful relationships. And what I think about is talking to somebody in person, or at least if not on text but phone, developing a relationship with somebody who you give the shirt off your back to, if that's that kind of friend. Or you could tell this person anything about yourself, even if you are ashamed, even if the stigma that still exists about being lonely. That's why Dixon, he said that people don't say they're lonely either. There's a stigma about saying you're lonely. I think that applies to many people. How many people, when you ask them, how are you doing? Even friends, if you say, I'm feeling lonely, how often are you going to say that? They should do research on Facebook and do different variables, questions, and try to address the level of intimacy that people feel they have in terms of, or they don't have in terms of their interactions on Facebook. It would be an interesting study, so there you go. Here's a study for you. So I mentioned before this 98-year-old woman who Carla was talking about, and that moved her to tears. So I have my version of that too. The paper that I did on one woman's struggle for dignity. She was an 83-year-old woman in her home alone. She had relatively little contact with people except with her aides, and she was alcoholic. And she survived three physicians 3 physicians. She was a very sophisticated woman, but she also was alcoholic, and there was no observation of that in the home until I got there, because that's one of my specialties. So I helped her stop drinking, and because I said, if your incontinence will stop if you stop drinking, and I left it up to her. But she was she didn't get out of the house for 2 years. It's like this 98-year-old woman. Her interaction in the world was going to the bed, going to the commode maybe, and that was it. So I worked with her for a long time. I had the ability to do that, and I helped her become sober. And all of a sudden, the aides in the house started to dress, because they were receiving help. They had hope. Somebody knew what they were doing. The other doctor didn't know what he was doing, because he was giving the patient Percocet because he didn't know anything about her alcohol. So that's lethal if you give somebody Percocet and they're drinking a lot, and she was drinking a lot. So anyway, long story short, she was able to. She became, how alcohol cuts your craving because there's so much sugar for foods, there's so much sugar in it. So we went outside for the first time in 2 years with her wheelchair, and she didn't talk to a doorman for 2 years. Maybe instead of, with the exception of going to the hospital for some crisis. So a lot can be done with women if you have elderly women and men, and usually more elderly women because they live longer. But a lot can be done if you had the time. I had a lot of time because I had the freedom to do that, the agency that I worked in. But she got sober. And one of the remarks she made during the way before I stopped working with her is she said, she said, I'm becoming people hungry rather than hungry for alcohol. So there are many things that we can do if we have the wherewithal and also the funds, But there aren't the funds. How many people, homebound elderly, are passed by? People don't even know that they exist sometimes. They get some services, but in terms of having social contact, like my agency went out and I was supervising paraprofessionals to visit the homebound elderly as well as doing it myself. But they're like they're people without a voice often in our society, the elderly. The older they get, the less voice they have, and the sicker they become. No one knows what that illness is. They don't even know what's behind those doors because no one visits them, except for emergency visits. Often when the people, are falling down, which they do elderly fall a lot, and or sometimes Meals on Wheels, if they're on that service, they will deliver meals, and then they would call attention is brought to their living condition, and then they will call the social service agency. So I'm going to sign off for now, and I hope I brought some information to you that's interesting, and I'm going to continue with this subject the next time because there's a lot to cover. So if you want to leave a comment, you can, and I open the lines for comments, and also send me an email if you want more information in terms of this talk or whatever I covered in it. I can fill it in, so you can send an email to marksehl@gmail.com or visit my site at marksehl.com. All right, so thanks a lot. If you like this talk, there's 2 things you can do. You can press the thumbs up or thumbs down. So please do one or the other, because that'll give me some idea about what impact this channel is having on the visitors. So thanks a lot. That's all for now. Bye-bye.